Hi, this is Dr. Yunhan Kim, and today we would like to continue the presentation on the hypothyroidism and Hashimoto's thyroiditis. Is it possible for a patient's Hashimoto's thyroiditis to be reversed? So the ideal patient is someone who has been diagnosed relatively recently. The mechanism of hypothyroidism by Hashimoto's disease, thyroiditis, is an autoimmune process where our body is being, specifically thyroid gland is being attacked by our own immune system, thereby destroying the capacity of the thyroid gland to produce thyroid hormones. So it stands to reason that a person with their thyroid gland more intact, less destroyed, would be more likely to make a full recovery, not requiring medication. So once that ideal patient has been identified, confirmed with labs and symptoms of hypothyroidism, then one of the most reliable tools for my practice has been LDN, Low Dose Naltrexone, which is the use of the medication, FDA approved medication naltrexone, from using it regularly rather than using the regular doses. We'll be advocating for the use in much lower doses, maybe as low as 0.1 milligram. In the field now, 0.5 milligram to 4.5 milligrams of naltrexone or LDN is what is seen commonly, and it is thought that it helps with autoimmune processes by normalizing or optimizing immune system. That means that if one's immune system is too overactive and it's attacking itself, the LDN is capable of optimizing or bringing that towards the normal. Exactly how this is done is not yet known, but it looks like that LDN is capable of lowering inflammation in the immune system. So once I find a patient with hypothyroidism who has not started their medication, who do not need medication, then we can use LDN and see how they do. So as I shared with you, we can start LDN in multiple doses. My favorite dose is 0.1 milligram or 100 micrograms. At this dose, the side effects to LDN is rarely seen. It's still possible, but not seen as much. And if one is able to benefit from LDN, I've seen people benefit from even 0.1 milligram. So, and then after that, I either stay at that dose or increase the dose systematically and get to a dose where patient feels comfortable. And then probably the most important part is to recheck the labs as early as 1 month to see if there is any difference in the lab, the results of the LDN on the thyroid panel. And then, of course, the increase is determined by patient's symptom and patient's lack of side effect. I find that LDN has changed the way that I'm able to treat hypothyroidism as well as other autoimmune conditions. And in the next video, we will discuss what happens if one is already on a thyroid replacement, like equivalent of Synthroid or levothyroxine and whatnot. Thank you.